My name is Dr. Sreevatsa. I'm a consultant cardiologist at Sahyadri Narayana Multi-Speciality Hospital, Shumoga. I've been practicing cardiology since last 8 years, and in today's podcast, I'll be talking about hypertension. As you're aware, India is known as the diabetes and hypertension capital of the world. Because of the increasing trend in obesity, cardiovascular diseases remain the number one cause of death among Indians. And hypertension remains a significant cause of both morbidity and mortality. Hypertension is the leading cause of stroke, heart attack, peripheral vascular diseases, and sudden cardiac deaths among Indians. So, how do you diagnose hypertension? Hypertension is usually diagnosed in the clinic by using either repetitive measurements, that is, at least 3 visits of more than 140 or diastolic pressure of 90, multiple readings like this, or one admission, which is stage 3 hypertension, which is very significantly raised blood pressures 180, 100 like that, or by using the best method to diagnose is by using what is known as ambulatory blood pressure monitoring or ABPM. So ABPM will record your blood pressure for 24 hours. Why it is beneficial? See, many a times when patients come to hospital because of anxiety or because of intake of certain drugs or some underlying medical condition, the blood pressure may be spuriously elevated. So this is known as white coat hypertension. Sometimes also it is the other way. When the patient is in clinic, the pressure will be high, pressure will be low, and at home the pressures may be high. So both ways it can occur. So to counteract this problem, we have this ambulatory blood pressure monitoring, which will record the patient's blood pressure like every 30 minutes. The patient will wear the device and go home, and it will be attached to him for 24 hours, and it will give an average of both daytime and nighttime recording and 24-hour recording. If the pressures are more than the recommended range, then diagnosis of hypertension becomes easier. So now the latest guidelines recommend using either ambulatory blood pressure monitoring or home BP monitoring to diagnose hypertension, or if not available, then we can always use the average of 3 office readings to diagnose hypertension. So hypertension is a common problem. Now it is the increasing obesity among Indians. What is known as diastolic hypertension in young because of obesity is a common problem. Hypertension is no longer a disease of the elderly population. So when you diagnose someone with a hypertension, what are the medications recommended? These used to be known as the class A, B, C, and D. A stands for ACE inhibitor or angiotensin receptor blockers. The B used to stand for beta blockers. Beta blockers are no longer preferred as the first line of hypertension therapy. C stands for calcium channel blockers, and D stands for diuretics. So most of the times, it is the target of achieving blood pressure should be systolic pressure of less than 130 and a diastolic pressure of less than 85. This is the recommended therapy. If we are not able to achieve this one, then there is no point in treating patients with hypertension. So this was also recommended in the SPRINT trial, aggressive and many multiple other trials, that aggressive control of blood pressure not only prevents complications like heart failure, stroke, and cardiovascular disease, but also can improve longevity. So many studies have proven this. So the first line of treatment among not just Indians across globe, the recommended therapy is a combination therapy, that is ACE inhibitor or ARB plus a CCB, that is calcium channel blocker. So this is the best time tested this one to reduce mortality, morbidity like MI, heart failure, and stroke. So a combination of ACE inhibitor ARB plus a CCB is the best therapy in the management of hypertension. When this therapy is, you should try to achieve, the as I mentioned, systolic BP of less than 130 and diastolic of less than 80 with the highest tolerable dose of these drugs. If you are not able to achieve this one, then you can use other therapy, that is thiazide-like diuretics, that includes chlorthalidone or indapamide, etc. So hypertension is a common problem among Indians, and early detect many patients. It is one of the studies mentioned that 1 in 4 hypertension patients are not diagnosed only, and 1 in 5 hypertensive patients are on appropriate therapy. So it is underdiagnosed, undertreated, and is a significant complications. So I urge you all to be aware of this diagnosis of hypertension and management guidelines, which are very appropriate. Old drugs like beta blockers are no longer preferred as first line therapy. Please remember this. ACE inhibitors or ARB in a combination with CCBs are the first line drugs, and add-on therapy with a thiazide-like diuretics. So this was some brief, whatever brief knowledge I had about hypertension, I've shared with you. I hope it has given you some insight into how hypertension is diagnosed and managed. Thank you.